I'm Dr. Jen Bickerton, founder of the Vitamin Advisor and the Vitamin Advisor podcast. I'm here with Dr. Emmanuel Apostolitis, the co-founder of Nutrimins, and Dr. Robert Nash, the founder of the UK natural products drug discovery company, PhytoQuest Limited. Dr. Nash is also a professor at Swansea University Institute of Science and Technology, and has published over 250 papers, many with Oxford University chemists and biochemists, and he has several granted patents. Today, we will be discussing with Dr. Nash the award-winning Q-Actin, which is the branded ingredient used in the Nutrimins product, Joint Force. Both Dr. Apostolitis and I are excited to have Dr. Nash with us today. Welcome, Dr. Nash. Thank you for being here.
Thank you very much for the invitation to talk to you.
So let me ask you first. Here's what we want to talk about. What is Q-Actin?
Q-Actin is a patented standardized cucumber extract, which is used for reducing inflammation. It's purely cucumber, no other natural materials are added into it or anything else.
I absolutely love that. So what are the benefits of Q-Actin?
Inflammation is involved in all sorts of illnesses. It's thought to be one of the things that's involved in the aging process, for example. But most of our studies with Q-Actin have been on osteoarthritis, which is an inflammatory disorder where you get chronic inflammation in the joints, which leads to damage of the joints, which is progressive. And there's no really useful treatment for osteoarthritis apart from reducing the pain. So the interest in Q-Actin is that it seems to be able to reduce the damage that's being done in the joints and therefore could allow healing to occur. And this is really remarkable.
That is remarkable. And I love that it is a cucumber extract. So what led to this idea to study a cucumber extract and its effect on joint health?
It comes down to the anecdotal claims around cucumbers that, you know, everyone knows about. You see pictures of women with face packs and cucumber rings on their eyes. It's supposed to reduce redness, puffiness, skin inflammation. And if you look in the literature, it's being used traditionally for treating sunburn, for example. And these uses go back way before the cosmetic industry, back to ancient Greece, Rome, Egypt, where they all valued cucumbers, not just as a food, but I think probably for its medicinal properties. They had no antibiotics or other treatments, therefore the foods they ate were probably also medicines for them. And there are many records of the importance of cucumbers in Rome, for example. So we looked at the literature and we thought, well, actually, what is it that's anti-inflammatory in cucumber? We looked at the literature and couldn't find anything that really explained the anti-inflammatory activity. And various other workers had published papers saying, yes, there was something anti-inflammatory, but they didn't know what it was. And most notable was a Japanese group who said, yes, it was definitely having an anti-inflammatory effect, but then they thought it might be just due to the water content. And we thought this is ridiculous. There must be more to it than just having water in it. Otherwise, there wouldn't be all these different anecdotal claims. So we had a look at cucumbers in our analytical methods where we looked really for any novel types of compounds, and straight away, a particular molecule stood out as being unusual. And just by chance, some synthetic chemists we worked with at Oxford synthesized it just randomly, the same molecule. So when we saw this molecule in cucumber, we thought, oh, that's the one Oxford have just sent to us for analysis. It's the same molecule. And we thought, oh, it's a new compound. It's a new natural product. It was a new synthetic compound as well. Very simple structure. And so we then looked at a number of different cucumbers and found that it was in some and not in others. And so that's how we got interested in the molecule. We had synthetic molecule from Oxford. We isolated the molecule. We put it into anti-inflammatory assays, and lo and behold, it seems to be responsible for all of the anti-inflammatory activity of cucumbers.
So was this the IDOBR1 amino sugar?
Yeah, so IDOBR1, we gave it that name. it's a completely novel natural product. It doesn't occur in any other plant. So although we've looked at a lot of amino sugars in the past, we've never seen this one before. And now, of course, we know what it is. We've been looking at lots of other plants for it, and it doesn't occur in anything else. It's really unusual. And cucumbers just has this one compound, which stands out amongst the amino acids and the sugars. But it's those common amino acids like aspartic acid, citrulline, and the common sugars like glucose and galactose that are really hidden this molecule, because it behaves very much like those, and people without the reference compound weren't able to identify it as being present because they wouldn't have known what it was. So we're very lucky to have had the link with Oxford University producing the molecule so that we could get a conclusive identification of the molecule and test its activity as in pure form.
I think this is very exciting because, the standardized, especially for a lot of health professionals and chiropractors, are to recommend products like glucosamine and chondroitin. And a lot of people use these. And I noticed that in the research, you compare Q-Actin to glucosamine and chondroitin. And so why did you choose to make that comparison?
Well, obviously we were aware of the interesting glucosamine and chondroitin. And when you look at the literature, you find that glucosamine and chondroitin don't tend to work very well. They do something. They maybe have a short-term effect, but then it levels off. And there have been some more recent studies, large studies, such as the GATE study, where in fact it didn't seem to do much better than placebo. And it seemed with osteoarthritis, even running a placebo, you seem to get some apparent improvement in the patient. So glucosamine chondroitin does something, but it doesn't seem to be that impressive. And the other thing that interested us is we analyze a lot of plants, a lot of herbal products and foods, and glucosamine is actually in almost everything you eat. So I didn't believe that glucosamine could actually be doing very much if you're just eating more of it, because it's in the diet anyway. And so just eating a bit more, I didn't think was really going to be that significant. And in fact, that does seem to be the case from the clinical studies that have been done. Chondroitin is, I'm not convinced that it can actually get to the joints in a significant way. So that's why we were interested in comparing glucosamine and chondroitin, because we knew that IDOBA1 had a definite anti-inflammatory activity. It was an interesting new molecule, and therefore we decided to do the study comparing Q-Actin and glucosamine and chondroitin as one of the major products that people use for treating osteoarthritis that we don't think works very well.
True. And another thing I read was the amount of glucosamine and chondroitin that is being used in a supplement versus the amount of Q-Actin. Can you highlight some of the clinical studies for us?
Well, most of the clinical studies that have been reported on glucosamine and chondroitin use enormous amounts, I mean grams per day. But we knew that the IDOBA1 was highly effective at low concentrations, which we could see from cell studies and human ex vivo blood studies, but it was very effective at low doses. So we thought that actually it'd be interesting to compare Q-Actin at a low dose, 20 milligrams per day, compared to the normal dose for glucosamine and chondroitin in clinical studies, which is usually around 2.7 grams a day. And in the study we did, we were able to show that there was a significant improvement in the osteoarthritis patients over 6 months, whereas glucosamine and chondroitin had an effect, but the Q-Actin was far more active, giving over a 70% improvement in these people. These were people from 45 to 70 years old, 122 people, males and females. So it's quite a large study, run for a long time. And the interesting thing about it was there was a steady improvement right up to the end of the study, whereas glucosamine and chondroitin, it leveled off. So the fact that there was still an improvement at 6 months suggests that actually if we carried on for longer, the improvement might have continued. It might have been even a better result, greater than 70% improvement. And it also opens up the possibility of the damage being reduced so that some repair of the joints can actually be occurring as well.
So with this study, what was the mechanism of action for the anti-inflammatory effect of Q-Actin?
Well, we've done a lot of studies looking at the mechanism of action, both in cells, ex vivo blood, for example. And so there appear to be a multitude of mechanisms possible, but one particular one we were interested in was the importance of a particular receptor that's overexpressed in joint damage. So you get an increase of the expression of CD44, which binds hyaluronic acid. And so you get more of that expressed in osteoarthritis in the joints. And so we were interested in the fact that IDO-BR1, which is an analog of iduronic acid, so very similar to elements of hyaluronic acid, in fact, was that actually interfering with this receptor binding hyaluronic acid, which is known to be involved in the inflammatory response that causes the damage in the joint. And sure enough, we were able to show that IDO-BR1 reduces the binding of hyaluronic acid to CD44. So it's not just reducing the binding of hyaluronic acid to CD44. What is known that happens when hyaluronic acid binds to CD44 is there's a sialidase induced, and that sialidase seems to be involved in a cascade of reactions that result in an increased production of TNF-alpha. And we've shown that IDO-BR1 reduces TNF-alpha, so it seems like there's a possible mechanism there involving CD44, reducing the production of TNF-alpha, tumor necrosis factor alpha, which is overproduced in chronic inflammation. I mean, TNF-alpha is a useful cytokine. It's anti-inflammatory, is involved in preventing diseases, for example, but in chronic inflammation, you get too much of it produced, and it's very damaging to the joints, so that it eats away at the cartilage, eats away at the bone. And so IDO-BR1 can reduce TNF-alpha, and it seems that it may be working via interfering with this interaction between hyaluronic acid and CD44. So we're able to reduce TNF-alpha both in cell culture, ex vivo blood, and we think also in joints. And that's giving the improvement, we think, in the osteoarthritis in the clinical studies that have been done.
So this Q-Actin in dietary supplement regimens, would you say it would benefit those that they want to be more active, maybe those in the aging population? And then also, why? Give a summary of why you think health professionals should recommend Q-Actin supplements, like Joint Force, to their clients and patients.
Well, I think one of the important points is it doesn't seem to have any adverse effects. The dose is very small. It seems to be able to reduce inflammation. The product is very stable. So we know the molecule is also very stable in the body. So we know it's likely to be distributed around the body. It's eventually excreted in urine unchanged. So remarkably stable, very good bioavailability. We've also shown, not just in the elderly people, who would obviously be a target for osteoarthritis, we've also shown, for example, in brain cell culture, that it also seems to be able to reduce the production of inflammatory signals in brain cell culture. That's not to say it will work necessarily in neuroprotection, but there's indications that with the elderly population, it might be something to consider as well. We've also looked at some sport fitness studies. So for the younger population who want to go to the gym or do intense exercise, it also shows a reduction of TNF-alpha in the blood, also producing anti-inflammatory cytokines like IL-10, so they're slightly elevated. Therefore, it's likely to reduce pain, muscle damage, for example, in intense exercise. So younger people might also want to try it for reducing the damage that inflammation can cause to muscles, for example, and enable them to do intense exercise more often. So, and the same with elderly people, you know, very often they suffer more from extreme exercise with aches and pains. So that's largely caused by inflammation as well. So therefore, you know, it seems very good for both the younger population and the elderly population.
I recently read where Q-Actin won the Nutrition Industry Executive Award in 2021, that was. That must have been exciting news to hear after all of this research that you've done with Q-Actin.
Yeah, no, it was great because this is a very prestigious award by health experts in the nutrition industry, and they look at consumer need, the safety, the standardization of the products, and it won in the healthy aging category in this award, and that was fantastic because we know it has all these benefits. It's giving good clinical results. And, it works both in cell cultures and in people. So, it really is a good product, and the dose is very low. And this is another thing which they thought was remarkable. Obviously, compared to glucosamine and chondroitin, it's remarkable that 20 milligrams a day can give a better effect than 2.7 grams or so of glucosamine and chondroitin.
I love that. And I really love that it was in the healthy aging category because Dr. Apostolitis, this is the whole premise of the Nutramen's brand is for healthy aging. So I want to switch for just a moment and I want to ask Dr. Apostolitis, would you have any input or any questions for Dr. Nash? This is wonderful having you both here today.
Well, first, I would like to thank you, Dr. Nash, and thank you, Dr. Bickerton. Dr. Nash, as you know, I'm a very strong believer of Q-Actin. And I don't know if you remember, the first time I was exposed to Q-Actin was more than a decade ago, when still the ingredient was under development, and I tried a sample at the Supply Side West. I had actually back pain, and I forgot my Advil, and I was walking in the show, and I had pain, and from Nutragenesis, Bruce Abaddon told me, please try that and tell me how you feel. And I tried Q-Actin, and I felt after a few hours walking, going back to the room, just with Q-Actin, I was feeling much better. So from that point on, I knew that you were on spot, on your target to develop this ingredient. After that incident, of course, you did the 2 clinical trials that confirmed the effect. At that point, you didn't have the clinical trials, but we were very, very convinced and happy to see this ingredient out in the market. And it is a very useful tool for consumers. We have been using your ingredient, Q-Actin, for more than 5 years in our formulas. And we have seen the effect from many people and customers that have used it and improved their everyday life, including myself.
Yes, we have many, many very happy users, including Dr. Bartholomew, who does the assays here at PhytoQuest. She's got some early arthritis in her hand, and she took 1 dose of Q-Actin, and it goes for a few days. If she takes 2 doses, it never comes back. This is early stage osteoarthritis, whereas the clinical studies were done in moderate arthritis, so they have more serious problems. So obviously it can work in the early stages of joint pain, not just in the later stages.
I agree, and I would like to thank you so much for giving us this ingredient that is so helpful. Thank you so much.
Okay, thank you. And the other important point to make is that, of course, it's standardized to 1% IDOBR1. You can't just buy any cucumber and expect to have an IDOBR1 content that's going to be effective. There are around 4,000 varieties of cucumbers. Many have nothing, but also the volume of cucumbers you would need to eat to get the 1% IDOBR1 is actually very great. And you don't know what you're eating without the analysis. So the standardization is very important.
And Dr. Nash, this is an excellent point that you are making about the standardization process for branded ingredients. And recently, we have developed a webinar presentation that describes the differences between standardized ingredients or general ingredients and branded ingredients. And our viewers can access it on our YouTube channel or on their Podia account and get more information about it.
Yeah, it's very important because we've also noticed that although some varieties can produce more IDOBR1 than others, it does depend on factors, and those varieties, if they're grown in a different place, may not produce any. And that's been quite a surprise to us. So you really need to check the cucumbers you're using, and that's what's done for producing Q-Actin. It's measured very carefully to make sure that the 1% IDOBR1 is always there.
Yes, that's a very important point. Thank you for bringing it up. And also, I want our listeners to know that the Vitamin Advisor and Nutrimins has more information for health professionals. So please reach out to us. You can go to the Nutrimins website, and you can go to the Vitamin Advisor website. So I want to thank you both for being here today, Dr. Apostolidis and Dr. Nash. Thank you so much.
Thank you, Jan, and thank you.